Greetings from Chapel Hill, North Carolina, where I was fortunate enough to have been trained 30 years ago. I'm Tim Shaughnessy, and I spend much of my time practicing orthodontics in suburban Atlanta, Georgia. In our paper on inadvertent tooth movement with fixed lingual retainers, we are referring to the unusual but sometimes severe problems which can arise when a fixed retainer breaks but remains bonded to some or all of the teeth, or when an intact retainer is distorted by function or was not passive when bonded. This paper was stimulated by a patient who was referred to my office in 2013 with surprising and unexpected mandibular anterior tooth movement and periodontal damage despite an intact, small diameter, flexible spiral wire bonded to each tooth. You can see that the attachment loss is in the direction of the displaced roots, both buccally and lingually. This patient's coordinated perio-ortho treatment is chronicled in the paper. Through word of mouth among a few colleagues, a dozen or so other examples of tooth movement created by a fixed lingual retainer were collected. In this example, a dead soft wire broke, resulting in independent movement of the two intact segments. Here, a stiff wire bonded to the canines only was displaced downward, resulting in expansion across the canines. It appears that problems like these can happen with any type of fixed lingual retainer. However, there are different types of tooth movement and problems that are specific to the different retainer designs and wire sizes. For example, torque discrepancies between adjacent incisors are more likely to be seen with small diameter, flexible spiral wires, and these wires have the greatest chance of catastrophic failure. What causes these problems? We discuss this in the paper, along with suggestions for supervision of patients with fixed retainers and for sharing this task with the patient's general dentist. We hope you'll take the opportunity to read the article in this month's edition of the AJO-DO.